Some patients experience genuine, often severe physical symptoms, pain, fatigue, gastrointestinal distress, for which extensive medical testing repeatedly finds no identifiable physical cause, yet the symptoms and the suffering they cause are entirely real, not imagined or faked. Somatic symptom disorders reveal that the boundary between psychological distress and physical experience is far less clear-cut than most people assume. Somatic symptom disorder is diagnosed when a person experiences one or more physical symptoms that are genuinely distressing or significantly disrupt daily life, accompanied by excessive, disproportionate thoughts about the seriousness of the symptoms, persistently high levels of health-related anxiety specifically about the symptoms, or excessive time and energy devoted to health concerns related to the symptoms, with the diagnosis explicitly not requiring that the physical symptoms lack a full medical explanation, since somatic symptom disorder can co-occur alongside a genuine, diagnosed medical condition. Illness anxiety disorder, previously commonly referred to as hypochondriasis, involves persistent, high-level preoccupation with having or acquiring a serious, undiagnosed illness, accompanied by high health-related anxiety and easily alarmed responses to health-related information, but critically, with minimal or entirely absent actual physical symptoms present, distinguishing it from somatic symptom disorder, in which genuine, often significant physical symptoms are actually present alongside the excessive symptom-related distress and preoccupation. The gate control theory of pain, well established in pain neuroscience, proposes that psychological factors including anxiety, attention, and mood can directly open or close a neurological gate in the spinal cord that regulates how much pain signal actually reaches conscious awareness in the brain, providing a well-documented physiological mechanism showing that psychological state does not simply accompany physical pain experience, but can directly and measurably amplify or dampen the actual intensity of pain signal transmission, offering a scientifically grounded bridge between purely psychological and purely physical understandings of symptom experience. Interoceptive sensitivity, referring to a person's attentiveness to and subjective amplification of ordinary internal bodily sensations that most people experience but do not consciously notice or worry about, such as minor variations in heart rate, digestive processes, or muscle tension, is theorized to contribute significantly to somatic symptom disorders, since individuals with heightened interoceptive sensitivity and anxiety-driven attentional focus toward bodily sensations may perceive, amplify, and become distressed by normal bodily processes that other people simply do not consciously register at all. Cognitive behavioral therapy adapted specifically for somatic symptom and illness anxiety disorders is the most empirically supported treatment approach, directly targeting catastrophic thoughts and interpretations about bodily sensations, such as automatically interpreting a headache as evidence of a brain tumor, gradually reducing excessive reassurance-seeking behaviors, including repeated doctor visits and internet symptom searching, which paradoxically maintains and reinforces health anxiety rather than resolving it, and using structured behavioral exposure to feared bodily sensations to reduce anxious hypervigilance toward normal bodily processes over time. Effective treatment for somatic symptom disorders critically requires close, collaborative communication between mental health providers and treating physicians, and requires that both explicitly validate to the patient that their physical symptoms and associated suffering are genuinely real and are not being dismissed, faked, or imagined, since patients with somatic symptom disorders frequently report feeling disbelieved or dismissed by previous healthcare providers, a pattern of invalidation that tends to increase symptom-focused distress, reduce treatment engagement, and worsen rather than improve overall clinical outcomes. Somatic symptom disorders reveal that the mind and body are not separate, independently operating systems, but are deeply and measurably interconnected. Psychological states can directly amplify genuine physical pain and other symptoms through documented neurological mechanisms. Effective, compassionate treatment requires validating these symptoms as entirely real while addressing the psychological processes that maintain and intensify them.